Welcome to the office.
You said these are traveling injuries?
What
is that?
The recent one, so C7, the C7 injuries, I was traveling like 3 times,
Talk to me.
3 weeks out of a
Welcome.
month for the last 7 months.
Okay.
And just long haul trips and different beds. And then
What do we mean long haul trips?
East Coast, so.
Truck?
No, driving. You know, so 5 hours on flight.
Oh, okay.
Yeah.
Flying.
But it was like, I would say twice a week I was, traveling.
Back and forth, east and
for
west?
3 weeks a month, yeah.
Okay.
And that was probably for the last 6 months. My right arm started to feel a lot of numbness, tingling, and actually start seeing some, atrophy, shrinking of the muscle.
On the right side?
On the right side.
Okay.
And once traveling kind of calmed down, I said, I have to take care of myself. And it came with one day where my right arm just like felt numb for like almost a day.
Now
and a
meaning
half.
it fell asleep?
Yeah.
No feeling?
No feeling.
No power?
No.
Could you
And
raise it up or anything?
I could do that, but it was just like really weak and I couldn't feel it. So I took myself to the emergency room and they did CAT scans and they just said maybe it was a pinched nerve because I couldn't see anything. And then I went to my neurosurgeon. He's the one that did my fusion.
And the fusion was for what?
About 7 years ago, I passed out. I was dehydrated. The LAX airport fell flat on my face.
Okay.
And my neck just got completely tweaked. And so that one, the left arm, was actually getting atrophied and stuff. And after a long term of trying to fix it, doing stuff like this, and I finally had to do the surgery because I was getting like these severe headaches.
Because the issue was what though? You had a pinched nerve. You had a swollen.
No,
disc,
the
you fractured the bone.
Swollen disc. It was actually pushing against the nerve in my spine. I mean, I have the diagnosis, and so that's why they had to do that.
And that helped.
Yeah, it took a lot of this away and this away, but I still get nerve pains, to this day.
Okay.
Which is one of the reasons I'm still taking Cymbalta.
Got it. Okay. All right.
And then so this one's at C7, which is right below the fusion point.
Say that one more time.
C7.
So did they fuse? So I'm trying to.
C456 is what's fused.
Correct.
Yeah.
So they fused it together. They added bone chips in there.
Cadaver bone, right?
Right. So they added the cadaver bone.
Right at 5.
At 5. Okay. And but you still have the nerve pain.
Yeah.
Less nerve pain, but still there.
Still there. Yeah.
Okay. Weakness.
Not as much so. The right hand side is
More
what's more recent.
And when you say more recent, what's going on with the right arm?
Like I said, numbness, tingling, pain.
All fingers?
Yeah, all fingers, forearm, back. This went away because I had 3 sessions of injections into my back.
Okay.
And after the 3rd one, that's where it really kind of started taking some of the pain away. I still get the numbness and the tingling.
When was your last injection?
I want to say 6 weeks ago.
Oh, okay.
Yeah.
All right. And that's your number one issue?
That is my number one issue, and also it's almost like I have a pinched nerve right in my back that just hurts all the time.
Okay. And so those are the main issues.
Those are the main issues.
Mid-back and neck, arm.
Mid-back, neck, arm.
What about the low back?
That one flares up every once in a while, but nowhere near as... I've had the lower back problem since I was 18.
Yeah, it's an old injury.
Yeah.
20, 30, about 30 years, yeah.
Yeah, I think it even formed like some sort of bone spur over the...
All right. So, one of your employees told you to come see me.
Yeah, he told me to
How's
make
it
sure I
going?
record so you can
How's
see
it
me
going?
online. He's doing really good.
Yeah?
Yeah.
Right on, dude. Anything else I need to know about?
No, I think so.
Okay, along the way, you have any questions, you ask. You're
Okay.
not comfortable with anything I'm doing, you stop me. Okay?
No, you know about the neck, so that's all.
Well, if I have to adjust 3 or 7, I
Yeah.
can still do it.
Yeah, I just had another chiropractor that I told him and he forgot and he just went,
When was your last adjustment?
I want to say 2 years ago.
Okay.
Yeah.
You ready to start?
I am.
Let's do it. Let's come over here and let's go over your x-rays. Now, when we look at the overall appearance, We got a few things going on we need to talk about. And the first thing we need to do is let's start over here in your foundation. And let's see, do we have a level base foundation? You played pretty hard, dude.
Yeah.
You played hard. What'd you play?
Soccer, wrestling, skateboarding.
Here? Pasadena?
No, Texas.
Is that you grew up in Texas?
Yeah, but I played a lot of soccer here, still do.
Okay.
Well, not recently because of this injury.
Okay. So let's look.
Weightlifting. Yeah,
Sorry?
Weightlifting, powerlifting, that kind of messed me up quite a bit.
Yeah. Okay. All right, so let's look at the foundation. This is the right side, this is the left side. And if we look at it, the first thing is, are we level? Are we balanced? We're a little bit off, yes? We can see the shapes are a little bit different. The pubic bone is slightly off the center. We have a bent tailbone. And what you can see right here is, you see this whitening over here on both sides?
Yeah.
So that's calcification or scar tissue in the SI joint. So that low back is stuck. I'm pretty sure you're compensating for whatever's going on here. And I'm going to zoom in so you can see what I'm talking about. You see this?
Yeah.
So you can see through the SI joint here, but then what happens when you get here? It's fused. You can see through the SI joint here, but then what happens when you get here? Scar tissue. Do you see what I'm showing you?
Yeah, I get hip pain.
Okay. Now, when we look at the hips, you actually are getting a little bit of calcification of the ligament here on the right side. The right looks slightly lower than the left. Let's see. Okay. Now this makes sense. These are what the numbers mean.
Yep.
All right, so we do have a short leg on the right. The measured difference is 7 millimeters. The actual difference with correction of the pelvis is 6. The idea with the base, if we have, you have a leg length, so you have a short right leg.
I broke my growth plate when I was 18.
You did, right?
I mean, when I was a freshman in high school.
In your knee or your hip?
In my ankle.
Oh, okay. Cool. Not cool. You broke it doing what?
Skateboarding.
Okay. So it's all kind of connected, right?
Yeah, I had
so that
cast all the way up to my hip for like 6 months.
That explains then the dropped tailbone. Because I was going to say is we have a tailbone injury. And you can see the sacrum on the right side is 4 millimeters lower than the left side. So 4 millimeters of this 7 is coming from a dropped tailbone. Does that make sense?
Mm-hmm.
Okay. Now, let's see what the numbers mean. We have AS2IN3, rotated sacrum on this side. So here's what's going on with you. This is the left side, left SI joint. The left pelvis goes up and in. The sacrum on that side goes to the left. So the overall effect is your foundation wants to go which way? To the left. But you have a short leg on the right causing you to come back. So I'm pretty sure when you walk, you got the Pasadena wiggle. Okay, I'm pretty sure you got that. Now, let me zoom in and show you a few things here. Okay, so your foundation's going left, but you see how your spine is curving slightly to the right?
Yeah.
That's the disconnect in your low back. Okay, so the fix of the low back or the foundation is what the book says to do between a rotated sacrum and an ASIN on the side of a rotated sacrum, the book says to do the sacrum. In your case, I would be going way down low here because you're bent from down here. So whatever that tailbone injury was caused that shift. I'm going to go to the side profile. You can see what I'm talking about. You see that nub right there?
Yeah.
That's what I'm talking about. So we're probably going to start somewhere down here. Okay, probably. If I dig a little, we'll come back to that x-ray in a second. Let's go back. So far so good?
Mm-hmm.
So foundation tilts one way, then what happens? The next one to go off is 5. It takes all these vertebrae with it. And then what happens? It comes back to level. You have arthritis here and here, spondylosis. The reason I'm pointing this out, this has been there a while. And so this arthritis, or what the body's trying to do, it's trying to fuse this area.
That's the thoracic area?
Yes, sir.
Yeah.
So it's trying to fuse here, 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 it's trying to... Why is the body trying to fuse with calcium? Is because you've had instability for so many years. But you sucked it up, right? You take the pain?
I'm a glutton for pain, yeah.
Right?
I mean, look at what I hardware have.
We'll get there. We're not even there yet.
So yeah, the MRIs I saw show exactly this too. Yeah.
So all of this is all that fun stuff you had going on back in the day. We'll get to the hardware in a second. You see this area here is the area that controls your digestion. Your digestion is pretty bad too, okay? And I do need to explain this because part of the fix for you, part of your case is maybe what you think or maybe not what you think. Your case to me, number one is getting the right foundation. Number two is cleaning up this digestion. You see this little black hole here?
Mm-hmm.
This is called the Blvd. This little hole should be, watch my cursor, this big. So when I don't see that big black half circle there and I'm looking at all this undigested food in the gut, up, across, and down, you have a lot of undigested food sitting there. So you haven't processed a lot of this. There's a lot of just toxicity in the gut that needs to come out. It's an easy enough fix. You need to make a few changes, okay? Basic stuff. You with me so far?
Yeah.
All right. So when we're looking at the side profile, the first thing is you need to have the right curve. Your spine is too straight. Are you able to get your movement, your walks, daily walks in? Are you going to be able to do that?
Yeah.
Okay. This curve is your spine is way too straight here. You need to have a little more curve in the low back. And the way we're going to help you get that curve is by fixing that left pelvis. Because the ASIN, when it goes up, causes the sacrum to go back a little, causes a straightening of the spine. So to help you get a little curve back, I'll do my part. I need you to do yours. Lots of walking. Fair enough? Easy stuff?
Just walking?
That's it. I don't need you in the gym. I don't need you rehabbing. I just need you to walk, hike, swim. That's it. So let's go over your discs. And the first thing I would say is let's look at your L5. The shape of the disc tells me about 25 to 30 years ago, okay? But I want you to notice, so 5 is off, 4. But we're going to go a little deeper and give you a different answer. Check this out. This is really cool. This is your L5, okay? I'm going to zoom in. Because what we think this is, it is not. This is actually a spondylolisthesis. This is the back of 4. This is the back of sacrum. And this is your L5. So your L5 is anterior to both 4 and sacrum. This is from an old pars fracture that was from one of your injuries. So 5 went slightly forward. And the fix of that is going to be down in the sacrum. So it's different between a L5 moving back, a sacrum moving back. What happened with you is this. So whatever your injury was, see the way the vertebrae are shaped and the way the mechanics of the joint are, they're going to move back first. But if we look at yours actually moved anterior. You see this 5 here?
Mm-hmm.
And you see all this is all scar tissue. There's an old pars fracture here. And the pars is this pillar right here. So the pars had to have injured in order to let that L5 translate anterior. And if we look at the shape, this is 25, 30 years ago, whatever it was.
Yeah, it was 18.
Okay?
Yeah.
So far so good?
Yeah.
But your discs are still good. This is a little thinner, but this is wearing out because it's compensating for this. These discs are all still good. These discs are all still good. These discs are good. This is a little kink in the spine, but the discs are fine. Even with the whatever calcification, your discs are all good there, okay, sir? Now let's get to this neck. So that's C2, C3, 4, 5, 6, so there's nothing we're doing there. But let's look at your flexion extension of the neck and let's get some answers. This is your neutral, yes?
Yeah.
Okay. When we go into extension, they should move back. Okay? Go forward, they should move forward. Your 3 didn't move. Your 3rd cervical didn't move. You have jaw deviation. You had some jaw injury?
It was related to the fall.
Got it.
Yeah, I fell flat on my face.
Okay.
So I broke teeth, broke my nose.
So all this is related to that?
Yeah.
Okay. So the last thing I want to talk about is your upper cervical here. Check this out. This is the upper cervical. C1 on the right. The capsule is there. C1 on the left. That disc is wearing out, or that capsule is wearing out. So the idea why I'm mentioning all this, we need motion. You need movement. You got a lot of stuck joints in there.
Yeah, I used to go to an ENT therapist that would do all these crazy massage and stretching.
Did it help?
Yeah, it did.
Okay.
That was like the last of me trying to fix my neck before I got surgery.
Got it. Okay. Starting at the base of the neck. And I'm actually getting up top, Atlas C1. It looks like it's going to be left, but then it goes to the right there, right side. T4, left side. 12 points. It looked... Actually, we're going to go with the lower one. This is going to be an interesting case. T8 looked like it was up here first. But it doesn't break back to until here. That's a big discrepancy. All right. S4, somewhere around T8. Seven. Oh no. 1, 7, 8, S4. Those are the majors that I'm finding, okay? Let's go ahead and statically palpate, see what we find. 6. That's 7.
Yeah, that's
tender.
4. Yeah.
2, 3, 4, 5, 6, 7, 8. More tender at 8 or 9?
8.
7?
No.
8.
8.
8. 7, 8. Let's check down low. Back slowly towards me, sir. All the way back. All the way back. That's 5. Pain?
No.
S1.
No.
S2.
Yeah.
This is where I'm getting.
Oh, whoa, right there.
S3.
Woo.
Ooh, that's the one. S3, T8, C7, and we'll check up top. Numero, left side 1, right side. Turn left, turn right. Turn left, look down, down and left, down and right. Look up at the ceiling, up and left, up and right. Which one is most restricted for you? Down or up?
Down.
Down and left, down and right.
Sorry.
Down and left or down and right?
Down and left.
That's the Atlas C1. So we have C1, C7, T8, S3. You ready to get this power on, sir?
Yeah. I'm ready.
Let's do it. Let's go over here on this table. So here's my game plan. We're going to do T8 and sacrum here. You'll come off, you'll walk a little bit, we'll recheck.
Okay.
Okay? And we'll go from there. And we said the short leg was on which side?
Right side.
So we need to now torque it which way? Counterclockwise to bring the right side up. Okay? This way. I need you to relax the shoulders, brother. Home run, baby. I got you. I had to, brother. You okay? That was deep. That was deep. That was deep, dude. 1, 2, 3, 4. I got him sweating on that one.
Oh, shit.
Sorry. No, you're good, dude. Nice. That was the home run, dude, that we say.
Well, I really like the surprise versus. Are you ready for that?
Are you ready?
I don't want to tense up.
Come over here. Let's walk it off. That was deep. Walk about 3-4 times, please, back and forth. It'll be a little different now. Cool. A little different when you're walking?
Yeah.
Yeah, what's different?
It's a little more like fluid.
A little smoother.
Yeah.
Let's see. Let's recheck. Let's see what happened. So I have a PhD in distraction, by the way. That's the joke. Starting at the base. Doo-doo. Sacrum is clear. 8 is clear. There is some heat, but it's clear, and I'll show you in a second. Now let's see what happened here. Head down. 7 is still there. 1 is there. Okay. Before I work on your neck, I want you to see this, okay?
Okay.
I want you to feel this. You remember what S3 felt like?
Yeah.
L5. Bueno?
Yeah.
S1. Bueno?
Yeah.
S2. Bueno?
Yeah.
S3.
Not as hot. Yeah.
Cool. Now we got to do your C7.
Okay.
Do I have your permission?
Yes.
All right. So what we're going to be setting is this, okay? We're setting the C7 on the bottom side as a PLS over here. And if you look here, 4, 5, and 6, or you can actually just look here, I guess. All right, so we're setting C7 as a PLS. It's going to be very, very, very light. And now I want you to see the actual mechanics. This is 6, this is 7. We're very specific on the distal, we're using the distal palmar surface of the index finger. We're on the posterior lateral aspect of the spinous process. The idea is we're going to lift and move it slightly forward, not very hard. Left ear down. Okay, I got you the whole way. I'm not twisting you, sir. I'm just pushing it forward like that, okay? Mm-hmm. All right. Nice and easy there. Left ear down, down. There. Down. Home run. Gotcha.
Thank you.
You're welcome. That was it, though.
Yeah, I'd be lying if I wasn't.
It was nervous.
Yeah.
But that's it. It's not harder or less than. That's it.
Okay.
Move the head to the left. Move to the right. Look up at the ceiling. Up and left. Up and right. Bueno?
Yeah.
A little different, right?
Yeah.
Just check the power in the hands.
Still crunchy.
Good. Squeeze. Good. Let's recheck that C1 and see what happens. Sit up straight. That should have cleared everything now. So we did C7, T8, S3. I ain't messing with the top one. That's clear.
C3?
No, C1.
Oh.
C1's clear, C7 is clear. We got heat there, but T8 is clear. We got sweat too. Low back is clear. That's where we're going to start. I'm going to tune up your extremities now, okay, sir?
Okay.
All right. Next, this is bonus, ears. Shoulders. Let me do the work. Don't help, please. Let me do the work. On your back, please. Raise it up. There you go. So the best part of this story, guys, is that the employee told the boss to come see Dr. Rahim.
He did.
And the boss didn't even see any videos. He came in blind. So that's respect you got for this guy.
Oh yeah.
That's the point. Nice. It's not powered. You played hard. That's good. Now you gotta work.
Yeah.
Let me check your jaw.
Sure.
Have a seat. Slowly open, close, slow, slow, slow. Yeah. So it goes from right to left and then it compensates on the left. So this left side compensates, the right side is the issue. Open all the way. We're going to do the left EX. Open all the way, close half, and just relax. There you go. Open. Good. Close. Now we're going to do the machine. We're going to break up some scar tissue on the TMJ. Stand up, walk it off one last time, make sure you're good. Bueno?
Hello.
All good. Squeeze. Squeeze. Oh, easy, easy.
Oh, sorry.
Easy. Squeeze. Okay. Any questions?
Nope. Thanks a lot.
Welcome to the office.
Thank you.